Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 15 practice NCLEX questions. Without delay, let's get started.
The nurse is instructing a client who is at risk for peripheral vascular disease how to use knee-length elastic stockings. The teaching plan should include which of the following? Select all that apply. 1. Apply the elastic stockings in the morning. 2. Remove the stockings if swelling occurs. 3. Apply the stockings while in bed. 4. Once the stockings have been pulled over the calf, roll the remaining stocking down to make a cuff. 5. Keep the stockings in place for 48 hours and reapply using a clean pair of stockings. The correct answers are 1 and 3. Elastic stockings are used to promote circulation by preventing pooling of blood in the feet and legs. The stocking should be applied in the morning before the client gets out of bed. The stocking should be applied smoothly to avoid wrinkles, but the top should not be rolled down to avoid constriction of circulation. The stocking should be removed every 8 hours, and the client should elevate the legs for 15 minutes and reapply the stockings. Clean stockings should be applied daily or as needed. A client is scheduled to undergo right axillary to axillary artery bypass surgery. Which of the following interventions is most important for the nurse to implement in the preoperative period? 1. Assess the temperature in the affected arm. 2. Monitor the radial pulse in the affected arm. 3. Protect the extremity from cold. 4. Avoid using the arm for a venipuncture. The correct answer is 4. If surgery is scheduled, the nurse should avoid venipunctures in the affected extremity. The goal should be to prevent unnecessary trauma and possible infection in the affected arm. Disruptions in skin integrity and even minor skin irritations can cause the surgery to be canceled. The nurse can continue to monitor the temperature and radial pulse in the affected arm. However, doing so is not the priority. Keeping the client warm is important, but is not the priority at this time. One goal in caring for a client with arterial occlusive disease is to promote vasodilation in the affected extremity. To achieve this goal, the nurse should encourage the client to 1. Avoid eating low-fat foods. 2. Elevate the legs above the heart. 3. Stop smoking. 4. Begin a jogging program. The correct answer is 3. Nicotine causes vasospasm and impedes blood flow. Stopping smoking is the most significant lifestyle change a client can make. The client should eat low-fat foods as part of a balanced diet. The legs should not be elevated above the heart because this will impede arterial flow. The legs should be in a slightly dependent position. Jogging is not necessary and probably is not possible for many clients with arterial occlusive disease. A rehabilitation program that includes daily walking is suggested. The client has aching, weakness, and a cramping sensation in both of the lower extremities while walking. To promote health and maintain the client's level of activity, the nurse should suggest that the client try 1. Cross-country skiing. 2. Jogging. 3. Golfing. 4. Riding a stationary bike. The correct answer is 4. In this case, the exercise prescription needs to be individualized because walking causes discomfort. To maintain the level of activity and decrease venous congestion, riding a stationary bike is another appropriate exercise behavior. Use of a stationary bike provides a non-weight-bearing exercise modality, which allows a longer duration of activity. Jogging and cross-country skiing are weight-bearing activities. In addition, cross-country skiing involves a cold environment, and maintaining warmth is essential in promoting arterial blood flow and preventing vasoconstriction. Golfing is a good activity, but it is not typically considered an exercise that causes aerobic changes in the body. The client with peripheral vascular disease has been prescribed diltiazem. The nurse should determine the effectiveness of this medication by assessing the client for 1. Relief of anxiety. 2. Sedation. 3. Vasoconstriction. 4. Vasodilation. The correct answer is 4. Diltiazem is a calcium channel blocker that blocks the influx of calcium into the cell. In this situation, the primary use of diltiazem is to promote vasodilation and prevent spasms of the arteries. As a result of the vasodilation, blood, oxygen, and nutrients can reach the muscle and tissues. Diltiazem is not an anti-anxiety agent and does not promote sedation. It also does not cause vasoconstriction, which would be contraindicated for a client with peripheral vascular disease.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A client is receiving pentoxifylline for intermittent claudication. The nurse should determine the effectiveness of the drug by asking if the client, 1. has improved circulation in the legs, 2. can wiggle the toes, 3. is urinating more frequently, 4. is less dizzy. The correct answer is 1. Although pentoxifylline's precise mechanism of action is unknown, its therapeutic effect is to increase blood flow, and the client should have improved circulation in the legs. The client does not have nerve impairment and should be able to wiggle the toes. Urination is not improved by taking pentoxifylline. Dizziness is a side effect of the drug, not an intended outcome. A client with peripheral vascular disease, coronary artery disease, and chronic obstructive pulmonary disease takes theophylline 200 milligrams twice daily every day and digoxin 0.5 milligrams once a day. The physician now prescribes pentoxifylline. To prevent problematic adverse effects, the nurse should monitor the client's 1. digoxin level, 2. partial thromboplastin time, 3. serum cholesterol level, 4. theophylline level. The correct answer is 4. Pentoxifylline can potentiate the effects of theophylline and increase the risk of theophylline toxicity. Therefore, the nurse should monitor the client's theophylline level. Pentoxifylline does not interact with digoxin. Pentoxifylline can interact with heparin, and the client's PTT would need to be monitored closely if the client were taking heparin. It does not affect cholesterol levels. A client with a history of coronary artery disease has been diagnosed with peripheral vascular disease. The physician started the client on pentoxifylline once daily. Approximately 1 hour after receiving the initial dose of pentoxifylline, the client reports having chest pain. The nurse should first, 1. initiate the rapid response team, 2. contact the physician, 3. encourage the client to relax, 4. document the episode in the chart. The correct answer is 2. Angina is an adverse reaction to pentoxifylline, which should be used cautiously in clients with CAD. The nurse should report the client's symptoms to the physician, who may prescribe nitroglycerin and possibly discontinue the pentoxifylline. The client should rest until the chest pain subsides, and documentation is essential when a client experiences an adverse reaction with medications that have been prescribed. However, the nurse's top priority is to call the physician, report the problem, and obtain a prescription for nitroglycerin. The client's reports of symptoms should never be dismissed. A client with peripheral vascular disease is recovering from an aortofemoral popliteal bypass graft. When developing a postoperative education plan, which question by the nurse will provide the most helpful information? 1. How did you manage your health before admission? 2. How far could you walk without pain before surgery? 3. What is your home environment like? 4. Do you have problems with your retention? The correct answer is 1. Assessing the individual's health behavior before surgery will help the nurse and client develop strategies to manage the postoperative course. Asking open-ended questions will elicit the most helpful information. The client's ability to walk after surgery will be improved after surgery. The nurse can ask direct questions after obtaining general information. The client with peripheral vascular disease and a history of hypertension is to be discharged on a low-fat, low-cholesterol, low-sodium diet, which should be the nurse's first step in planning the dietary instructions. 1. Determine the client's knowledge level about cholesterol. 2. Ask the client to name foods high in fat, cholesterol, and salt. 3. Explain the importance of complying with the diet. 4. Assess the family's food preferences. The correct answer is 4. Before beginning dietary interventions, the nurse must assess the client's pattern of food intake, lifestyle, food preferences, and ethnic, cultural, and financial influences.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
While the nurse is providing preoperative teaching for a client with peripheral vascular disease who is to have a below-the-knee amputation, the client says, "I hate the idea of being an invalid after they cut off my leg." The nurse's most therapeutic response should be, 1. You'll still have one good leg to use. 2. Tell me more about how you're feeling. 3. Let's finish the preoperative teaching. 4. You're fortunate to have a wife who can take care of you. The correct answer is 2. Encouraging the client who is undergoing amputation to verbalize feelings is the most therapeutic nursing intervention. By eliciting concerns, the nurse may be able to provide information to help the client cope. The nurse should avoid value-laden responses, such as, "You'll still have one good leg," that may make the client feel guilty or hostile and block further communication. The nurse should not ignore the client's expressed concerns, nor should the nurse reinforce the client's concern about invalidism and dependency, or assume that his wife is willing to care for him. The client asks the nurse, "Why can't the doctor tell me exactly how much of my leg they're going to take off? Don't you think I should know that?" The nurse responds, knowing that the final decision on the level of the amputation will depend primarily on 1. The need to remove as much of the leg as possible. 2. The adequacy of the blood supply to the tissues. 3. The ease with which a prosthesis can be fitted. 4. The client's ability to walk with a prosthesis. The correct answer is 2. The level of amputation commonly cannot be accurately determined until surgery, when the surgeon can directly assess the adequacy of the circulation of the residual limb. A longer residual limb facilitates prosthesis fitting and will make it easier for the client to walk. However, although these aspects will be considered in the final decision, they are not the primary factors influencing the decision. A client has undergone an amputation of 3 toes and a femoropopliteal bypass. The nurse should teach the client that after surgery, which of the following leg positions is contraindicated while sitting in a chair. 1. Crossing the legs. 2. Elevating the legs. 3. Flexing the ankles. 4. Extending the knees. The correct answer is 1. Leg crossing is contraindicated because it causes adduction of the hips and decreases the flow of blood into the lower extremities. This may result in increased pressure in the graft in the affected leg. Elevating the legs, flexing the ankles, and extending the knees are not necessarily contraindicated. The nurse is monitoring a client after and above the knee amputation and notes that blood has saturated through the distal part of the dressing. The nurse should immediately 1. Apply a tourniquet. 2. Assess vital signs. 3. Call the physician. 4. Elevate the surgical extremity with a large pillow. The correct answer is 2. The client should be evaluated for hemodynamic stability and extent of bleeding prior to calling the physician. Direct pressure can be used prior to applying a tourniquet if there is significant bleeding. To avoid flexion contractures, which can delay rehabilitation, elevation of the surgical limb is contraindicated. The client has had a below-the-knee amputation, secondary to arterial occlusive disease. The nurse is instructing the client in residual limb care, which of the following statements by the client indicates that the client understands how to implement the plan of care. 1. I should inspect the incision carefully when I change the dressing every other day. 2. I should wash the incision, dry it, and apply moisturizing lotion daily. 3. I should rewrap the stump as often as needed. 4. I should elevate the stump on pillows to decrease swelling. The correct answer is 3. The purpose of wrapping the residual limb is to shape the residual limb to accept the prosthesis and bear weight. The compression bandaging should be worn at all times for many weeks after surgery and should be reapplied as needed to keep it free of wrinkles and snug. The dressing should be changed daily to allow for inspection of the stump incision. No lotion should be applied to the stump unless specifically prescribed by the physician. The stump should not be elevated on pillows because this will contribute to the formation of flexion contractures. Contractures will prevent the client from wearing a prosthesis and ambulating.
You can get the NCLEX Mastery Bundle now, link is in the description, or you can get it at alphanurseguide.com.